Sensitivity, specificity, and efficiency. Diagnostic sensitivity is the probability that only patients with the disease will test positive for the disease. Sensitivity has to do with quantity. So if a test system is 100% sensitive, that means 100% of the time, if something is there, it will be detected by the test system. That largely depends on the quantity or the ability of the test to pick up even the smallest amount in a sample. And when I talk about sensitivity, I always compare this to the pregnancy test. So in order to test positive as being pregnant, you need to have a certain level of HCG in your bloodstream. So let's say on the first day that HCG is starting to be produced by the fertilized egg, and it's starting to be produced and slowly being released into the bloodstream. On day one, or at that very second that it starts being produced, if you test with an at-home urine pregnancy test, it's going to tell you that it's negative because it hasn't reached detectable levels yet in the bloodstream or in the urine. So it's going to be a negative test result. Doesn't mean you're not pregnant. It just means that that test system isn't 100% sensitive. It's not capable of detecting even the smallest quantity. When you have poor diagnostic sensitivity, it leads to false negatives, because in the pregnancy test result, even though HCG was starting to be produced, it wasn't produced at the high enough quantity, so the person ended up falsely testing negative, even though they were actually pregnant. Diagnostic specificity is the probability that patients who do not have the disease will test negative for the disease. Specificity has to do with being as specific as possible to only detect what it's actually testing for. Now, sometimes test systems will turn positive in the presence of a lot of different substances. That means that that test has poor specificity. Poor specificity leads to false positives, because if it turns positive for substance A and it turns positive for substance B and it turns positive for substance C, and we're actually testing for substance A, well, if the patient has B or C in their system, then they're going to show a positive result. And they're going to be reported as having substance A even though they didn't, all because the test system can't differentiate between those different substances. So that test system would then have poor specificity, and it would lead to the development of false positives. So sensitivity is correlated to false negatives. Specificity is correlated to false positives. The best test has 100% sensitivity and specificity. These numbers can be calculated below. So sensitivity has to do with the number of true positives over the number of true positives plus false negatives times 100%. And specificity is the number of true negatives over the number of true negatives plus false positives times 100%. True positives, the number of individuals who actually have the disease and test positive. False positives, tested positive, but do not have the disease. So true means it's correct, positive is the result. False means that it's an incorrect result and it incorrectly reported as positive. True negative means the number of individuals who do not have the disease and test negative. False negatives are the number of individuals who have the disease but test negative. And here is the HCG percent sensitivity and specificity for a particular example. Another sensitivity and specificity example. A new kit was developed to detect the presence of group A strep in throat swabs. The manufacturer tested the kit on 600 pediatric patients with a presumptive diagnosis of group A strep. 475 tested positive for group A strep with the kit. 460 were verified by culture to be positive for group A strep. 125 children tested negative by the kit. Of these 125, 20 were determined to be positive for group A by culture. So 20 out of the 125 actually had it and they tested negative. So what's the diagnostic sensitivity and specificity of this kit? You just plug those numbers into the equations that were provided previously, and you can do the math from there. So diagnostic sensitivity is calculated to be 95.8% and specificity 87.5%. This looks very involved, but when we start going through the different components, it's going to make a lot of sense. This is kind of a good reference that you can always go back and take a look at. So if we start here, we have test outcome. Now, if the outcome is positive, it would be reported as positive, and it would either be an actual true positive or it would be a false positive, which is also known as a type 1 error. If it tests negative, we can have false negatives, which are type 2 errors, and true negatives. Condition positive, true positive, or false negative, these people actually have the disease. Condition negative, these people actually don't have the disease. Sensitivity is correlated on this side, while specificity is on this side. And then positive predictive value and negative predictive value, we'll get into those definitions in just a little bit. Efficiency. Efficiency is the number of patients correctly diagnosed for the disease or not having the disease. The following calculation can be used. TP plus TN over TP plus FP plus FN plus TN. These abbreviations are for true positive, true negative, false positive, or false negative. So that's what those letters mean in there. So efficiency example. So using the previous data, what is the efficiency of the new Group A strep kit? The analysis of the new kit revealed the following. Use the formula, and we calculate efficiency to be 94.2%. Predictive value. So as I mentioned previously from that table, we have positive predictive value and negative predictive value. Positive predictive value is the ability of a method to correctly determine the presence of a disease in patients who have it. Patients who are positive for the disease will test positive by the test method. Negative predictive value, the ability of a method to correctly determine the absence of a disease in patients who do not have the disease. Patients should test negative by the test method designed to detect the disease. These are calculated using the following formulas. Positive predictive value, TP over TP plus FP. Negative predictive value, TN over TN plus FN. Again, that's for true positives, true negatives, false negatives. And here is going back to that pregnancy example, and it's calculated out. A new assay was developed that promised to be able to detect prostate cancer in men before the development of any clinical symptoms. The manufacturer claimed that the new assay was more sensitive and specific than any existing tests for prostate cancer. Blood samples from 10,000 men who were asymptomatic for prostate cancer were tested. 8,000 tested negative, 30 later developed prostate cancer, 2,000 tested positive, 1,900 later developed prostate cancer. So looking back at the table, we can go back to those calculations and be able to calculate all of these different aspects.